Understanding long-term COPD effects and how to reduce risks according to WHO. Hello friends. Chronic obstructive pulmonary disease. Most patients only feel very slight changes in breathing, exercise capacity or persistent fatigue and isly ignore them. However, that very subjectivity opens the way for silent but irreversible damage to the lungs, heart and the entire body. Chronic obstructive pulmonary disease not only affects the present but also leaves long-term consequences, seriously reducing the quality of life if not properly controlled. In this video, we will scientifically analyze the long-term effects of chronic obstructive pulmonary disease, based on official recommendations of the World Health Organization and the United States healthcare system. The end of the video will emphasize the most important points that you absolutely should not ignore. Before going into the main content, invited you to register and turn on notifications for the MMM channel with the YouTube access name at mmm.youtube1 to continue accompanying us in the healthcare and disease prevention video series throughout the human life cycle. And now, we start the main content. Chronic obstructive pulmonary disease is one of the most dangerous chronic diseases of the respiratory system today. Not only because of the large number of sufferers but also because of the silent, prolonged and difficult to recover process. According to the World Health Organization, chronic obstructive pulmonary disease is currently the third leading cause of death globally, after cardiovascular disease and brain stroke. Each year, this disease causes more than 3 million deaths, accounting for approximately 5% of total global deaths. And this figure tends to increase due to population aging, environmental pollution, and tobacco smoking rates still being high in many countries. One is the global epidemiological scale and the widespread extent of chronic obstructive pulmonary disease. According to pooled estimates from the World Health Organization and multinational epidemiological studies, currently there are over 250 million people living with chronic obstructive pulmonary disease. In the population group aged 40 and older, the prevalence of the disease ranges from 10 to 12%, depending on the region and the level of exposure to risk factors. In the United States, analyses from the Harvard School of Public Health show that chronic obstructive pulmonary disease is the leading cause of limited working capacity in the elderly and is one of the most common causes leading to prolonged hospitalization. What is worrying is that a very large proportion of people with the disease are not diagnosed at an early stage, making intervention delayed and increasing the risk of serious complications later. 2 is the mechanism of disease progression and the direct link with respiratory function decline through each stage. Chronic obstructive pulmonary disease does not appear suddenly but forms through many years of cumulative damage to the airways and lung parenchyma. Pathological studies of Johns Hopkins University indicate that prolonged chronic inflammation in small bronchi makes the bronchial walls thicken, the bronchial lumen narrow, while destroying the elastic structure of the alveoli. When the disease is still at a light stage, the patient may only feel shortness of breath when exercising strongly, but in fact the ventilation function of the lungs has begun to decline. When moving to the moderate stage, the reduction in expiratory flow increases clearly, making the patient short of breath even when walking slowly or doing housework. To the severe and very severe stages, the lungs lose the ability to exchange gas effectively, leading to chronic oxygen deficiency and increased carbon dioxide accumulation in the blood, creating the foundation for many dangerous complications. 3 is the relationship between the disease stage and the mortality rate proven by clinical data. Long-term follow-up studies at the University of California show that the mortality rate increases gradually according to the level of lung function decline. At the light stage, the mortality rate within 5 years ranges around the level of 10%. However, at the severe stage this figure can exceed 30 to 40%, and at the very severe stage the 5-year mortality rate can reach up to 50 to 60%, especially in elderly patients and those with accompanying cardiovascular disease. The World Health Organization affirms that the level of lung function decline is an independent mortality predictor, even when adjusted for age and gender. 4 is the cardiovascular and circulatory complications caused by chronic obstructive pulmonary disease. One of the most serious consequences of chronic oxygen deficiency is increased pulmonary artery pressure. When the lungs cannot provide enough oxygen, the right heart must work more to pump blood through the lungs, leading to hypertrophy and right heart failure. According to clinical analyses of Harvard University, about 30% of chronic obstructive pulmonary disease patients in the late stage have manifestations of right heart failure, and this is a factor that significantly increases the risk of mortality. In addition, chronic obstructive pulmonary disease is also closely related to heart rhythm disorders, myocardial infarction and brain stroke, due to the prolonged systemic inflammation state and gas exchange disorders. 5 is the role of exacerbations and the direct impact on the mortality rate. An exacerbation of chronic obstructive pulmonary disease is periods when the disease becomes heavier suddenly, usually due to respiratory tract infection or air pollution. According to a large cohort study at Johns Hopkins University, each severe exacerbation increases the risk of death in the following year from 15 to 20%. Those patients who have 2 or more exacerbations in a year have a mortality rate nearly double compared to the group without exacerbations. This shows that an exacerbation is not only a temporary event but a landmark, making the disease progress faster and more difficult to control. 6 is the link between chronic obstructive pulmonary disease and severe respiratory infections. Epidemiological analyses in recent years in the United States indicate that people suffering from chronic obstructive pulmonary disease have a clearly higher risk of death when contracting acute respiratory infections. In outbreaks of respiratory tract inflammation caused by viruses, the mortality rate in the group of patients with underlying lung disease is many times higher than in the general population. The reason is that the respiratory reserve of the patient has seriously declined, making the body not sufficient in capacity to respond when oxygen demand increases. 7 is the effect of chronic obstructive pulmonary disease on the whole body and the quality of life. Not only limited to the lungs, chronic obstructive pulmonary disease also causes muscle wasting, osteoporosis, depression, and cognitive decline. Studies of the University of California show that patients must consume more energy for the respiratory process, leading to weight loss, malnutrition, and muscle weakness. The quality of life seriously declines, making the patient more dependent on the family and the health system, while increasing the risk of indirect death due to falls, infection, and exhaustion. 8 is the problem of late diagnosis and long-term consequences. The World Health Organization estimates that from 40 to 70% of chronic obstructive pulmonary disease cases are not diagnosed at an early stage. When the disease is discovered, many patients are already at the moderate or severe stage, making treatment effectiveness limited. Studies in the United States prove that late diagnosis increases the hospitalization rate, increases treatment costs, and increases the risk of death within the next 5 years. 9 is comorbid diseases and the synergistic impact on the risk of mortality. Patients with chronic obstructive pulmonary disease usually simultaneously suffer from other chronic diseases such as hypertension, coronary artery disease, diabetes, and chronic kidney failure. The overlap of these diseases creates a synergistic effect, making health decline faster and increasing the total mortality risk. According to analysis from Harvard Medical School, patients with 2 or more chronic diseases accompanying chronic obstructive pulmonary disease have a mortality risk nearly 2 times higher compared to patients suffering only from lung disease alone. 10 is scientific evidence about the benefits of early and comprehensive management. Although chronic obstructive pulmonary disease cannot be completely cured, clinical studies in the United States and recommendations of the World Health Organization all agree that early, continuous and comprehensive management can slow disease progression, reduce exacerbations, and clearly reduce the mortality rate. Stopping smoking cigarettes, improving air quality, respiratory rehabilitation, and periodic monitoring are key measures, helping to prolong life and improve the quality of life for the patient. Finally, it is necessary to emphasize that lung health does not decline in a day but is affected gradually over time. Each time a prolonged cough is ignored, each time slight shortness of breath when climbing stairs is disdained, and each time delaying a periodic checkup, all contribute to increasing the risk of permanent respiratory damage. International health organizations all affirm that early identification of abnormal signs is the most important foundation to protect the ability to breathe freely and the quality of life. When people correctly understand the signals that the body sends out and act timely, the burden from chronic lung disease can be completely managed effectively. Proactive health monitoring not only helps prevent the disease from progressing but also contributes to maintaining a more active and sustainable life for yourself and your family. If you find this content useful, please register and turn on notifications for the MMM channel with the access name at mmm.youtube in English and the LQT channel with the access name at LQT YouTube in Vietnamese. On these 2 channels, we will continue to share in-depth content about protecting the lungs, liver, kidneys, cardiovascular system, and common non-communicable diseases under the most authentic scientific perspective. Health does not come from luck, but is the result of correct understanding and choices made at the right time. Thank you for following the entire content of this video.